Hi friends, I'm Dr. Sushant Soni. I'm MBBS MAMC, MD Pathology, Resident Hemato-Oncology, AIMS Delhi. And with me is Sushil Vijay sir, orthopedic consultant, orthopedic surgeon, and our satellite head in DBMCI Institute. So today we will be doing the orthopath correlation of Paget's disease of the bone. Paget's disease, which we have decided this topic as a correlation because this is a topic that is usually overlooked during the MBBS time by the students, firstly, and you do get numerous image-based questions with respect to orthopedics in Paget's. So the next level of question in this is from pathology. Though this has not been asked in pathology till now, but the ideal way to remember such a disease is through the orthopathological correlation. So let us start. Let us start with Paget's disease, also called as osteitis deformans. Firstly, it is a misnomer. It is a misnomer because the bone is deformed, we agree, but osteitis, there is no inflammation per se. It is Paget's or osteitis deformans. In pathology, we talk of this as a disorder of increased. It is an increased but disordered and structurally unsound bone mass. Disordered but structurally unsound bone mass.
Sir, actually, if I see as a student, it might seem easier for me to remember the definition, but it seems like more time, kind of, mugging it up. That it is something increased but disorder structurally. So, how we define in orthopedic classes that it is a disorder which is characterized by increase in clastic activity and then followed by increase in blastic activity. Right now, to understand the Paget, this simple definition, one image or one concept you all have to understand is that the blastic and clastic activity are always correlated because in bone we have only one cell and that is osteoblast. There is no other cell in the bones. It is only one, that is osteoblast. And you know that osteoclast is not a cell of the bone. It is a cell which is coming from the monocyte macrophage family, a group of or kind of giant cell, right? So isn't it? So basically, the cell that's giving troubles in the bone. How it gives the trouble, that we'll be discussing as orthopath correlation. So simply understand this. The very first line you have to remember in Paget's is it is a disorder in which there is more of a clastic activity, which will then be followed by increase in blastic activity, which will lead to troubles. Okay, let's see how it happens.
So, starting with the age group of Paget's, it is seen in late adulthood or elderly with an average age of about 70 years. In Paget's, both the genetic and the environmental factors contribute. Genetically, it is associated with mutations in SQS-TM1 gene. I am repeating this. It is associated with mutations in SQS-TM1 gene. With respect to pathology, this is a prospective question, which accounts for 50% cases of Paget, 50% cases of familial Pagets. Because of this mutation, there is an increase in activity of nuclear factor kappa B. There is an increase in activity of nuclear factor kappa B, in turn increasing the osteoclastic activity. In turn, increasing the osteoclastic activity. Firstly, this is the first genetic mutation. Next, it is also associated with activating mutations in rank and inactivating mutations of OPG. So three gene mutations: mutation in SQS-TM1 gene, activating mutations of rank, and inactivating mutations of OPG. Thirdly, thirdly, the various cell culture studies, they show that there is modulation of vitamin D sensitivity and interleukin 6 secretion by virally infected osteoclasts, the virally infected ones. So,
So, like what we discussed, like Dr. Sushant has already mentioned it, how basically the pathogenesis is happening or starting. But what we see clinically is that majority of these patients, they come to you after some sort of viral illness. And the most common culprit given in Harrison, as per I know, is paramyxovirus. So what the last line tells us, as per pathology, the cell culture studies have shown that interleukin 1, the 6 secretion, this is done by what? Osteoclast. So these viruses, they behave like inclusion bodies, which in turn activate the osteoclast. They were fine, but then suddenly these virus like inclusion bodies, they started activating the osteoclast. And if you remember from your physiology, if you remember the basic anatomy physiology of the bone, you know that if the osteoclastic activity increase, class is increasing, what it will do in turn, it will increase the number of osteoblast. And that is what I told you in the very beginning. What is PG? It's increase in clastic activity followed by blastic activity. So why the blastic is activated? It is all because the clastic is activated. That is the reason. Okay, so there is a correlation between these two cells. The clast when activated increase the blast. Blast when activated increase the clast. That is a chain. That is a circle. That is a the correlation between the two cells that has to go on. Okay, so these viruses will activate the clast, and that will lead to troubles. How? We'll just see.